Okay, let's go over the urinary tract real quick, and this does apply to females and males are going to have the same urinary tract system, just one is a little bit different. The male comes out, the urethra comes out the penis, and the females does not. Um, the urinary tract, let's go over it real quick. It includes the kidneys, which are going to be here, the ureters, which are going to be these things, the long things that look like shoestring type things. And then we have our bladder, which is the balloon-like structure right here. And then we have our urethra, which is going to come out of the bladder and then exit the body. The kidneys, back up here to the kidneys, they have one job, and that is to remove waste from the blood filtration system. And then the ureters, which are the long tubes here, those move the waste down into the bladder. The bladder, which is here, is a storage unit for those waste. It can expand. It's a balloon-like structure. It holds those waste until it is full. And then the urethra, which comes out of the bladder and exits the body, its job is to empty waste. The flow of urine encourages desquamation, which is the shed of the, it's to peel off the outer layer of the surface. So our flow of urine is actually very important, and it also has that flushing type motion that helps flush more of that bacteria and stuff out so it doesn't stay in there. If we just had a little steady stream bacteria, little bacteria, if we just had just a drip or two coming out, bacteria can build up in there, and with the flushing mode, it's kind of like a toilet. It just pushes everything out. The male reproductive system, it consists of the testes, which are here, the epididymis, which is this coiled-like structure that is here, the vas deferens, which is right here, and the prostate. I don't have a picture. Yes, I do. Right here's the prostate, and then the penis, which is right there. And again, we talked about the flushing action, and males actually benefit from this flushing action, because their urethra is a lot longer than females, but they also benefit from that flushing action as well. The testes, they have a job, and that's produce sperm and hormones. The epididymis, this coiled-like structure here, it leads out of the testes. The vas deferens goes into the ejaculation duct, and then the contents of the ejaculatory duct empty into the urethra, which is this little piece right there. And then the prostate gland right there contributes to the release of semen. And then the penis holds and houses the urethra, so then everything comes out that way. Okay, the female reproductive system includes the uterus, which is going to be here, the fallopian tubes, which are going to be these little structures on both sides, the ovaries, which are these little circular, weird shaped things, and then it also includes the vagina. An egg is released every 28 days. That's usually the cycle. So the egg is released. It enters the fallopian tube. So it comes here into the fallopian tube, where fertilization and sperm take place. And then once the egg is fertilized, it moves through the fallopian tubes like so and ends up into the uterus, where it implants in the uterine lining, and therefore we have a baby. If no fertilization takes place, the lining sloughs off and degrades, and that causes females to have menstruation, or what is also known as a period. The cervix is the most common site and the reproduction of the female reproductive tract for an infection, and that is going to be right here in this area. UTIs. Cystitis, also known as a bladder infection, usually occurs as a sudden onset. There are 1,000 different things that could cause a UTI, but the most major cause is the bacteria E. coli. Especially in females, everything is so close together in our anatomy that sometimes it is very easy, if we do not make sure that we are wiping from front to back, we have an accident or something like that and break our arm and it's hard and we're just trying to wipe any way we can. We can cause bacteria, especially E. coli, to come into contact with our urinary system, and then therefore we can have cystitis or a bladder infection. A couple of terms, dysuria and hematuria, are very common terms. Dysuria means burning upon urination. Hematuria is bloody urine. Cloudy urine is also a common symptom with the urinary tract infection. UTIs cannot be transmitted from person to person. They are not sexually transmitted diseases. Macrobid is the most often used antibiotic as a treatment for a urinary tract infection. If allergies do occur, another antibiotic will be used for that treatment, but macrobid is the number one. Other things that can cause UTIs include not urinating after having sex, tissue paper that may be scented or colored, have some type of dyes in it. Same thing with underwear. Some women can only wear white underwear. The dyes and those type of things in our underwear can affect the urinary tract. There's a lot of things that can happen and that can cause this. So there's not one particular thing, but the most common thing, of course, is E. coli. Leptospirosis is an infection associated with animals. It can be wild animals or domesticated dogs, raccoons, skunk, foxes. Those are just some to name a few. If this is left untreated, this can cause cell death in the kidney tissue. Penicillin G may be used as a treatment option. This is shed in the urine of infected animals, and it can survive into alkaline water in soil for months. Okay, urinary schistosomosis. I think I am saying this correctly. This is a helminth, and this is a picture of it I have on this slide. This particular helminth, it lodges in the blood vessels of the bladder, and symptoms just include your basic symptoms: fever, chills, diarrhea. This particular helminth is found throughout Africa, the Middle East, and the Caribbean areas. And this is often caused by exposure to raw sewage, which is why it's not so common here in the United States. Vaginitis. With vaginitis, there comes some degree of vaginal itching, from just very mild to very severe. You can have discharge and possibly burning with this as well. The most common form is Candida albicans, also known as yeast. Most women at some point in our time are going to have a yeast infection if we haven't already. Topical oral medications can be used, and most of them now can be gotten over the counter, but for more severe cases, or if you've tried the over-the-counter treatments and they're not working, you might want to see your physician to get a prescription. Trichomonas vaginalis. It is a small little pear-shaped structure that does have some flagella legs on it. In 50% of all infections, there are no symptoms, so we can be walking around with trichomonas and not know it. It is vaginalis, but it can affect males and females, not just females. Chronic infections can make a person more susceptible to HIV. If you acquire this during pregnancy, you may result in a low birth weight baby or premature labor, and if it progresses, it can go to even things as bad as infertility. And research has also now linked this infection with prostate cancer in males. And this is such a common infection, it affects 10 million Americans. Prostatitis. I gave a picture here of the normal prostate and then the prostatitis. So it's inflammation of the prostate gland. Symptoms include pain in the groin area, lower back pain, difficulty urinating, painful ejaculation, because like we said before, this does assist in that process. Cipro and levofloxacin are typically prescriptions that are prescribed to help with this. All right, guys, we're going to talk about gonorrhea. It's been around since ancient times. This is one of the oldest STDs that are known. Symptoms can include, especially in males, can include yellow discharge. Females can include a bloody mucus, like containing pus, vaginal discharge. Both can experience painful urination. The long-term effects of this include pelvic inflammatory disease in female, sterility, and even ectopic pregnancy. Gonorrhea in the eyes from birth can cause serious complications, can even go as far as blindness. Newborns are, their eyes are equipped with the, as soon as a baby is born, they do put the eye drops, or the cream, whichever form it comes in, to protect their eyes from gonorrhea and some other STDs as well, but gonorrhea for sure, to keep them from getting in those eyes to potentially cause blindness. Diagnosis is mainly used through PCR testing of secretions or discharge. A combination of common antibiotics as recommendations for treatment. So it is an easy treatment. It's just one of those reportable ones that we need to catch before it spreads through the community. Chlamydia. It's the most common reportable disease in the United States. Most cases are females ages 14 to 19 years of age. Why is that? Because that is when they are most sexually active with different partners. It's 2 to 3 more times more common than gonorrhea. Males most often report painful urination, and females may report like their cervix is hurting, like a little bit of pain, discharge, those type of symptoms. Anytime that you think that you may be subjective to a STD, you need to go be checked just to see which one it is, because they all do require different treatment options, though most are treatable. Okay, syphilis. This is another sexually transmitted disease or sexually transmitted infection. The early signs of syphilis is a hard canker that will come up. I gave an example of one here on the right. This picture is a canker that is on the penis. They usually go away within 3 to 6 weeks, but if syphilis is not treated, this can go into painful tumors called gomas, and they can develop in the liver, the skin, bone, and cartilage. They're usually benign, but you don't want to walk around with tumors all over your body. So again, anytime that you may be exposed to this or think that you may have this, you need to seek treatment. Genital herpes is caused by the herpes simplex virus, and vesicles may appear on the genitals, buttocks, thigh, or the perineum areas. This is an example of some of the lesions that may appear that I have on this slide. Mostly like a clear fluid-filled like vesicle or blister will appear. This is a worldwide phenomenon that affects all sexes, races, and age groups. It's contact with direct secretions from an infected individual. And this is a non-curative disease, but medications can now be prescribed to help with outbreaks. The human papillomavirus, also known as HPV, may present as a wart-like outgrowth on the groin area. In males, this can occur most often in the penis, on the penis. or in the scrotum area. In females, it can occur on the vulva and or around the vagina. Males are most commonly affected by the potential to have penile or anal cancer. This also increases the risk of throat cancers and things with people who have oral sex with a person who is infected with this HPV. The mode of transportation for this particular virus is by direct contact.